the rheumatism blood test. Usually we get a patient who would tell us, I did the rheumatism blood test and it was fine. First of all, let us agree that in every field of knowledge in this world, there is the true science and there is the pseudoscience, or the misconception that has no scientific basis. Misconceptions can be truly so powerful and so established in people's knowledge and culture. What do I want to say? I want to say that there is nothing called the rheumatism lab test that really exists. Rheumatism is actually a term that refers to a group of painful conditions that affect the musculoskeletal system and not a specific disease or diagnosis. Diagnosis of each disease is actually based on the patient's history and examination and not on any particular lab test. So what does a patient usually mean when he says the rheumatism blood test? There are 3 lab tests that are known in the common culture of patients and some amateurs who insist on doctoring, but they are not doctors, of course. These are the ASOT test, antistreptolysin O-titr, the CRP test, C-reactive protein, and the ESR, sedimentation rate test. Any one of them alone, meaning without the symptoms and the examination of the patient, does not diagnose any medical conditions if its result was abnormal. Although this might sound odd to what some of you know, but it is better that you know this now so that you don't get into the unnecessary dilemma of doing odd lab tests for diagnosing odd medical conditions.